Hello students, and welcome to the Dr. Zaius medical facility. Today you will be all learning about some, basic medical procedures. I'm Dr. Curley. Dr. Zaius himself couldn't be here to teach you today. He's busy getting the lower class addicted to prescription opioids, so I'm going to be filling in for him today. So we're going to be starting with a nice simple heart transplant. The first thing you're going to want to do is just make sure that the patient, if they wake up, doesn't see what's going on. Well, they won't wake up. It's fine. So as you can notice, as you can notice here, the patient has a rather inconvenient rib cage in the way. Now, what we want to do with that is, well, we want to remove that quite obviously. There's numerous tools that we have in our disposal. We've got a bone saw right here. That's very useful. We got a drill, like you'd find in maybe B&Q. So if you're operating on quite a tight budget, this is very useful. If we just set it gently back down here. We've also got a hammer, which is what we'll be using today. Let me just get this out of the way. You want to grasp the hammer quite firmly, like you would any regular hammer. Now, what you want to do is you just want to kind of lightly tap the bone. And the Dr. Zaius toolbook, a light amount of pressure can be this, or it can be this. Make no distinction is what I think the doctor really wants. Now, don't be afraid to really get in there. Ribs, they don't have any nerve endings in them, and neither do any of the inside of a human being. And we know this because currently the patient isn't screaming. They usually do that when they're in pain, but Okay, and once the pesky ribs are out the way, the next thing that we want to get rid of is these lungs, right? Because the heart is right behind them, about here. So to get to the heart, after all, we are doing a heart transplant. Hang on, so let me just take a sip of water here. Tasty. What is this? What flavor is this? Orange burst. Maybe this guy wants a drink too. Just pour it into his mouth. There we go. It's important to keep the patient hydrated. But yes, sorry, as I was saying, you want to get rid of these lungs. They're in the way. Now, as previously, we have quite a lot of tools at our disposal. But really what you want to do, and what the good Dr. Zaius and I like to do, is just grab a hold of the lung quite firmly, and then just pull, and it'll pop right out, like this. You don't need to worry about the patient breathing. We've got them on all the respirators, so you can just put this to the side. And the same with the other one. You might need to get some of these ribs out of the way, but the lung should come out with little resistance. There are a variety of other organs in the way. I believe that's the brain. So we need to get that out of the way. And like with the lungs, this is it's attached a little bit. It's attached a little bit more firmly than the lungs, but it should come out with sufficient force. Just put this there for safekeeping. Okay, so now we can see, I believe that this is the spleen. That's kind of obstructing our access to the heart. Now, unfortunately, the hammer is not that useful here. You might think that we can just kind of hook the spiked end around and pull, but that's just not going to cut it. And so to cut it, we're going to need some of these scalpel tools. I like to get it between my thumb and forefinger here. This is a very delicate operation. What you want to do is you want to come down into the chest cavity and just give it a little wiggle, right? The blood loss is irrelevant because we are, after all, replacing the heart, and then we want to do the same on this side, and it'll just come right out. We can then remove the useless appendages. Just reach in and we'll set this to the side. Okay, so now we have access to the heart. It's got quite a few ribs in the chest cavity, but that's fine. They can be set aside and cooked up for later. Now, similarly to the spleen that we've just removed, the heart is connected to the body with a whole load of what do you call them? Tentacles? Yeah. So we need to get rid of those. We'll use the same tool between the thumb and the forefinger, and then we want to gently come in and cut, and the heart will just come right out. Expect some blood loss when this happens, but there's no, at this point you don't have to rush now, okay? This heart, it barely functioned anyway, so quite frankly, where's the bin? Where's the bin? Where's the bin? Well, we can just put it here for later. Nice. Quite simply, all we need to do now is open the box. The lids on these things can be quite difficult. This might be the hardest part of the entire operation. Now we've got a fresh, clean heart. We can just go ahead and grab that and just drop it into the cavity, and we're done. Next on the agenda is a double kidney transplant. We got the kidneys in here. I quite like kidneys. You know, some people don't enjoy the taste, but you know, I think they're quite nice. Once again, we're gonna cover the patient's face. He doesn't need to see this. Now, there's a lot of things going on here, unlike the heart operation. This patient's stomach area is just filled with worms, and you know, we don't want that. So to get these worms out, we need our patented Zaius worm removing tool. We just kind of want to give this a good saw. You know, you really want to get in there. Don't be afraid to be quite violent. These worms, they really get stuck in there. But soon enough, they will come loose, and then you just want to grab them and pull them out. You know, if the patient is losing a little bit of blood, then we do have some drugs that we can use to slow its heart rate. I believe this is meth, and we just want to jab the patient right in the eye, and that'll stop the blood loss from happening. You might see a little spout of blood right here, but that doesn't count. You can just plug that up with your finger. Okay, so now, as you can see, we got this worm in the way. We're gonna employ a slightly more delicate method of removing this one, because this is the gut worm. This one does need to be in here, but you know, it's still quite a tricky one to remove. You do need to give it a little wiggle, but it will come out with enough force. Some patients may have slugs in their cavity as well. This one does. So, you know, as we all know, that slugs are fucking horrid. So, you know, we're going to do our best to remove this. Maybe at a later date when we remove the lower ribs. To do this, we are going to use the hammer again, the patented Zaius method. Just get nice and deep in there. You know, really don't be afraid to just really go for it. You know, the patient patient can handle it. Sometimes the slugs inside people are very hard to remove, so we're going to need to employ some quite drastic measures. Just really get in there. You know, really get in there. Really just dig around. The third and final procedure that we're going to be taking a look at today at the Zaius medical facility is a brain transplant. Now, some surgeries have quite a lot of trouble in finding brains to do their transplants, but we here at the Zaius medical facility, we have brains in surplus. So if you see a brain you don't like before an operation, like this one, you can see it's a little too wrinkly, maybe a bit shiny. You can just go ahead and throw it away. Oh wait, shit, no, that was the only one we did have. Much like the rib cage, the skull is a barrier to all the good stuff inside. We have numerous tools at our disposal. Once again, we have the trusty hammer, but we also have first, let me take a little sip of orange blast. But we also have this this axe. I believe this is an iron axe. You know, it'll chop trees slightly faster than a wooden one, and it's also very useful for chopping brains. So what you want to do is chopping skulls. Sorry. So what you want to do is line it up nice and straight, and then just give it a nice crack like that. From the other side. Don't worry about the brain within. This one, you know, this one's bad. Oh fuck, I pricked myself with the needle. God, I need to slow this guy's heart rate down. Oh fuck, what's in this thing? Oh. Anyway, once the brain is exposed like this, we're gonna get the drill. No, we're not. Grab whatever the fuck this tool is and just get in there nice and gently. Get in the brain nice and gently and just wiggle it around a bit. What's all this red stuff doing on my hand? So once the brain is a little more exposed like this, you'll notice that it's being attacked by a rather vicious worm. So what we need to do is we really need to get rid of that. Now some might say that the most logical response would be to use this this big saw, and they would be correct. And once the brain is removed, you can place it to the side. You can see that this brain is quite grey, but we've got a nice fresh pink brain. Don't be afraid of just grabbing onto it with the full force of your hand. It doesn't matter if there's some blood residually on your glove. That blood's supposed to, it's his blood anyway, right? And now you just want to kind of drop it in there. And that concludes today's training session at the Dr. Zaius Medical Facility. I hope you have learned everything you need to start your career in medicine. I'm Dr. Curley. Thank you for watching. Bye-bye. Oh fuck, okay, yep, that wasn't his brain.